Hi, everybody. We're so happy that you've joined us today for our LinkedIn Live. I'm Jamie. I'm the SVP of Growth at Aware Health, and I am joined today by Matt Brost, who is the Vice President at Rockton. He's also the host of the Excellence Culture podcast. And he has 10 plus years in employee benefits. He's obviously, you see him on LinkedIn. He's really well known kind of as a thought leader in this space. And then I'm also here with Dr. Siobhan McDonald, who just passed her OCS exam, and we just posted about that yesterday, but she is one of our beloved physical therapists here at Aware Health. Thanks for joining me.
Hello, thanks for having us.
Hey there. Thanks, Jamie. Thanks for the shout out.
Yeah. Okay. This LinkedIn experience always creeps me out because it's like streaming live on my other screen and I can hear it. So I said that last time, but it just really, I don't know. Does anybody know how to fix that? Any of you LinkedIn Live people out there? Because it's very distracting.
I'm nervous to do this, so you're
Okay,
courageous
well,
to go to do this.
I gotta turn you up because now I can't hear you, Matt. Okay, so let's go ahead and just kind of frame the discussion today. So, Matt, you came to Aware Health and started with Dr. McDonald for low back pain, from what I understand, correct?
Yeah, I mean, there's kind of a little bit more of a story to it. So I had a lunch meeting that was set up with Heidi, your founder, and it happened to be right after I got PRP shots in my wrist. Okay? And if people don't know what PRP shots, let's kind of call it almost like stem cell injections to heal a wrist problem that I'd been having for years, to be honest, because I used to be a professional golfer and my wrist was just like out of whack. And so having that meeting, she said, "Hey, why don't you set up an appointment, with one of our doctors, and we can kind of look at things because." But then I got to that appointment and I had like thrown out my back prior to that appointment. So really, that appointment was more about my back than it was about my wrist. And that's when I got to meet Dr. Siobhan or Dr. McDonald, however you want to refer to her. And yeah, I mean that's where I guess you would say the relationship started, for sure.
Got it. Okay, so if I heard you right, you had some wrist pain and then you also had some low back pain and then you saw Dr. McDonald. What did you think when Heidi, our CEO, offered up virtual care? Were you like skeptical of the program or were you open-minded? Like, tell me a little bit about how you were feeling going into it.
Yeah. Well, until this, my only experience with virtual care has been via teledoc, and those appointments, in my experience, have been very transactional. So I'm thinking about something like, physical therapy on my back or my wrist. That just doesn't seem like it needs to be a transaction. It seems like it. So I guess I didn't necessarily go into my virtual session with a whole lot of good expectation, I guess. But I wanted to see it for myself for sure. And I was pleasantly surprised, no doubt.
In what way?
Well, I mean, so I've had some virtual teledoc appointments, and the person on the other end of the camera, I mean, they could be in their pajamas sometimes, right? But that's not Dr. Siobhan. She was extremely professional, very easy to talk to, and the amount that she cared for me and what I was going through was just a surprise to me. But what I liked at the beginning, if you remember this, Doc, is you just kind of, had the image of the body, and we were able to really look at the muscles and everything that I was struggling with, and it just like all started to make sense. So I would even say from a diagnosis standpoint, I was very surprised.
Mm-hmm. Yeah. Got it. And I think that I'd like to have Dr. McDonald speak a little bit about that, because that sort of patient-centered care is something that we really prioritize so that you don't feel like a number, you're getting compassionate care. So Dr. McDonald, could you speak a little bit about that?
Absolutely. And yes, Matt and I, we've gone through a lot together at this point. It's been it's been quite the journey, and we'll get into that a little bit
The
more. But
year, the year of
the
healthcare.
year of health, yes.
Yeah.
So generally, and just going back to Matt's past with the wrist pain and then the bout of low back pain, we generally try and treat the acute pain first. And it's like if we can get to the root of this, get you better faster with your low back, then we can address your wrist. And we were doing a little bit of both, but that's generally kind of our triage system there. So that was our first, yeah, our first couple encounters there. And now fast forwarding to patient-centered care. So oftentimes, healthcare providers assume that if we provide the education and a treatment plan, then individuals will just follow along with that plan. But with patient centered care, what we've seen is that outcomes are better and patients have more success when the patient plays an active role and is at the center of that care plan. So for us, that really starts with a focus on building trust, listening, and just finding what motivates the patient and with goal setting as well. So we try and touch on all of that really in the first visit, and then it continues throughout the course of the care.
This is just as an outsider, as a patient myself who is not a provider, that seems like table stakes to me, right? Like listening to patients, putting them
Mm-hmm.
at the center.
Mm-hmm.
So, like, why? I don't know. I'm kind of, maybe you guys don't have the answer to this, but like, why is it that this isn't the way that most providers are practicing today?
I think Matt said it really well that it can feel really transactional. It can feel rushed. It can feel like you've waited so long for this appointment and you have X, Y, and Z that you want to discuss. And then maybe you get cut off at X. And then you have to make another appointment for Y. And then that can take months and months and months. And it just feels like you're not. I agree, Jamie. It should be the standard. And to me, that is the standard. Like, I want every patient to feel listened to. Every patient is different and you have to adapt. But that I've even personally left appointments feeling just worse than when I came in because I just felt like, and they may have given me really good advice or knowledge, I guess, from like a anatomical perspective. I don't even know, but you just feel a certain way when you leave appointments, and I feel like that just goes a long way.
And I would say, like, the fee for service model is set up to be transactional,
Mm-hmm.
and for the providers, God love them, like they don't have a choice. Like
Mm-hmm.
they've got to see it as this appointment. I go on to my next appointment, to where the time that I had had with Dr. McDonald, I knew that hey, if during this 30 or 45-minute appointment we didn't get to everything, we could set up another one the next day if we wanted to.
Mm-hmm.
With another provider, that's not going to happen. And
Yeah.
would I even really want it to happen? Because I don't want to have to drive there again. Like, so so this. I mean, I think for us in our position, it's interesting. You've got a lot of brokers out there, and we try. There's a lot of brokers that are out there that try to act like they know about medicine more than doctors do. That is not me. Okay, like I will never hate on the people that are providing medical attention and at our heartbeat of our medicine, but I do see the system, right? Because I know how health insurance works. I know how the payer community interacts with the health system. And so I see that system, and there's no doubt that the subscription model for a lot of care seems to be delivering better results than the fee-for-service model. And I think that's kind of the main thing that we're talking about.
Yeah, we talk about how we are more like direct primary care for musculoskeletal conditions than we are physical therapy, right? Because so much of musculoskeletal pain is about really having that one-to-one patient-provider relationship, getting to the root cause, um, and also education, which you can't get reimbursed for.
So you had mentioned goal setting. Is that
Yeah.
where we're going? Okay, and kind of what that looks like from a patient perspective or someone new on the platform.
Mm-hmm.
Yeah. So what's actually funny is that Matt and I haven't even gotten to set goals for this new case yet. But with our previous case, we definitely did on the first visit. So goal setting plays a huge role in the patient-centered approach. So for example, just what does success look like to you? How do you measure progress? Or if I can do X, Y, and Z, then I'm in a better place than when I started this program. And in the traditional setting, and I've been there too, like the provider writes goals for the patient, and that goal may be to improve left quad strength or to improve range of motion, but that doesn't really mean much to the patient. And they may not even know that we have even written those goals. So in our setting, we dedicate time together on the first visit to write goals and rank each on a 0 to 10. So we have a baseline. And that could look like being able to squat 15 times so I can get on the floor, get on off the floor to play with my kids, or being able to sleep through the night without shoulder pain. And really knowing what your goals are from the get-go, discussing that from with your provider so you're on the same page, and then just also just having those in writing and tracking them over time and being held accountable to those, that I feel like is huge in the outcomes that we see because we're really focused and we're working together and I'm your guide and I will not give up until we meet those goals.
Got it. Matt, do you have anything you want to add about that?
No, with our first case, which I hate it that I've got so many cases going on right now, but with our first case, yeah, we were very focused on those goals, and what I like a lot about it too is that I think that there's a measurement whether that we're making progress toward those goals, because I think you all like you're not like a stubborn provider that says aware health is the only thing that somebody should do. Like you would probably track the process just as much to know like, hey, do I need more intensive care or something like that, right?
Exactly. It's a guide for our
Yeah,
treatment as well. Do we
for
need a
sure.
referral? But most of the time we don't. But definitely, like you said, I appreciate you saying that because we
Yeah,
definitely, at the end of the day, we want to do what's best for the patient, and that may be
yeah.
co-treating. Yeah. So there's always options.
Let's pivot then to talk
Mhm.
about Matt. You recently had a very traumatic accident where you fell through the roof. You
Yeah.
posted from the hospital. It was very clear to me how many people love and support you with the number of comments and reactions you got on LinkedIn. But that obviously you're in the middle of having, wrist and back pain and kind of getting a handle on that, and then you fall through the roof. So, talk us through that experience and sort of what you went through.
Yeah. Well, it was May 16th, probably a day I will not forget for a while. But May 16th, we had just done this big remodel at my house. And so everything new at this house everything at this house is new right now, including the attic is new. And so I was up there was an air conditioner issue. I just felt like I can go handle this. So went up to where the air conditioner handler is in the attic, and um, I didn't lose my balance or anything. I'm not going to get into why I fell through the ceiling, but I shouldn't have fallen through the ceiling, and I fell straight through my ceiling, dropped 15 feet, nothing in the way, and I ended up breaking 5 ribs. 2 of them were called displaced, which I'm still figuring out what that means. I had broken my elbow, punctured a lung, broken 2 places in my vertebrae, um, and and immediately, obviously, my 12-year-old daughter was the only one at the house, and she killed it, and she called 911 and took care of me, and then obviously had a ambulance ride to the hospital that was nearby, and went into the ICU. And so, yes, I did LinkedIn post because I don't even remember doing that, to be honest. But, common grace of medicine these days allows you to still function even though there's extreme pain going on in your body. Um, and so, yeah, during those 5 days there in the ICU, a number of doctors came in and out, but the reality is that I left the hospital that day without having a clue what I was supposed to do. and really not having a clue who I needed to go talk to first or who I needed to follow up with. How I was really going to get to this place of healing. And so I'm really thankful that I had already had a relationship going with Dr. McDonald. And I think you might remember that, Dr. McDonald, but I just didn't know what to do.
Mhm.
I had gone to see my family doctor, but that was more focused on kind of my medicine regime and refilling a prescription and that kind of stuff. And then I went to go see an orthopedic doctor, and that was just it was just a comedy of care, to be honest. Because I walk in there, I've got 8 broken bones, and the PA for the doctor said we can only focus on one area of your body during a visit because that's all insurance is going to pay for. And he didn't know, and I'm not saying I'm some special person, but he didn't know I was somebody that really kind of cares about the system a lot. And to tell me that, like, it just frustrated me, and I didn't want to go back there. So because that means that I would have to have 8 visits, for each bone that I was struggling with, and I don't have time for that. So that's when I talked to Dr. McDonald, and honestly, she's been helpful to be a guide for me during this process.
Yeah, it definitely seems like it all felt really isolating, just facing those issues. And you said you received really good care, in the ICU and in the hospital, but then
Awesome.
you get discharged. Yeah, which is great. I
Yeah.
was so happy to hear that. But then you get discharged, and then it's just kind of like, what now? And you're trying to manage this all while trying to reintegrate back into life and work and family, and it's just a lot on your plate. And just to if I can even just take one little bit off of that to where someone is checking in with you and working with you, whatever that day or that appointment may bring, and priority shift, context shifts, but like we will get through this together. I think hopefully that's been helpful
Yeah.
so
Well,
far.
what I'm hearing is like continuity of care because I don't even feel like I have that with my primary care or my OBGYN. Like the only time I've ever felt that continuity of care is when I was pregnant. And I
Yeah.
went to see an OB, and it was like, okay, you see the doctor once, like once a month, and then at the end, it's like once a week, and you generally see your OB. But like, I've never had that experience where I have a provider who I feel like is really looking out for me, and I can call, and they know my clinical history, they know my goals, they know the things I'm working on. So I think that like continuity of care is really missing in the way that our current system works in a lot of cases, which again, I go back to why we like to consider ourselves almost like a direct primary care, but for musculoskeletal, because it's a massive category. So many people, like 50% of people at any given time, have an MSK issue. It's not always as traumatic as what Matt went through,
A
right?
lot of times it is, though. Like, not
Yeah,
as traumatic, maybe, but I would say a lot of orthopedic issues or musculoskeletal issues root off of some type of trauma that might have happened.
yeah, absolutely. And I read a lot about MSK and just the comorbidities that are associated, like depression and anxiety is highly correlated with MSK and chronic pain. And so having somebody that is in like on your team, understands your clinical history and that you can call anytime without having to pay is like a godsend.
Yeah. But I would also say with the model that you guys, because you've got very high qualified people in those seats, like I could never rely on Teladoc for this, right?
Mm-hmm.
And so, Teladoc has its place for sure.
Mhm.
I think Teladoc and companies like that have their place for sure. But for that guide standpoint to kind of help you through trauma, it's just not set up for that.
Mm-hmm.
Yeah.
Absolutely. And
Anything
I
to
think
add,
that
Dr.
goes off of
McDonald?
what Jamie touched on with how there's so many overlaps with MSK. And that really goes into just overall wellness. And we can touch on that as physical therapists. And I think physical therapists as a whole have a very unique standpoint where we do spend a lot of time with our patients. And in a traditional setting, maybe you're seeing the patient, also 2 or 3 times a week in the clinic. But but there's more limitations there, and we we don't have a lot of those. So we definitely get to act as more of an autonomous provider and a direct care provider, like you said, Jamie.
Yeah.
Well, I don't ever see people using physical therapists as direct primary care people.
Mm-hmm.
Like it's like
Yeah.
I got injured or I'm recovering from surgery and now I'm going to go to a physical therapist. And we know that so few people see a physical therapist before they see an orthopedic
Mm-hmm.
specialist. And that often results in more aggressive care than what you need. And
Mm-hmm.
so I think something has to change. And I even think people think physical therapy is different from what it actually is. Like I had this view of physical therapy in my head where it's just exercise therapy. But since I've been at Aware, I've learned how much talk therapy and the biopsychosocial model is rooted in what we do. And the most modern evidence shows that like exercise is just one component of what
Mm-hmm.
physical therapists do. So I think we have a long way to go to evangelize the role of physical therapy in the patient journey.
Absolutely.
Yep, I agree.
Yeah.
Well said.
Okay. Well, let's close with some final thoughts. We can kind of go around the horn, and if there's anything else that you wanted to leave the audience with, we'll go there. So, Dr. McDonald, why don't you start?
Okay. Well, I have been really appreciative of Matt as a patient. Even like you said from the get-go, you came on the platform with such an open mind. You are obviously a very motivated person, and that translates into how you are as a patient too. And I'm sure that's no surprise to anyone who knows you and will be watching this. But it's been a tough couple months for you, and I know we're going to get there. And you've already made leaps and bounds, and I just am excited for where the journey is going to take us next. So thanks for hopping on here, and thanks, Jamie, for facilitating.
Of course.
Yeah.
All right, Matt, closing thoughts?
Well, I mean, thank you is on my side. So the journey that I've had so far, honestly, and I'm not like we especially at Locked In really are cautious to just promote certain products, but I can't help but just be extremely thankful for the fact that I met Heidi however many months ago, and I've been in you guys' care, for a while, because I would be in a pretty dark hole if I didn't have these conversations and kind of this direction from you guys. So really appreciate that. And I would just tell anybody, whether it's Aware Health or it's another solution that's out there, at any point, if an organization like you guys can intercept the journey of somebody dealing with MSK, whether it's before they even saw their primary care provider, or it's before they got referred to an ortho, or it's before they had an MRI, or even it's before they had surgery or after surgery. Like all those times, obviously the earlier the interception happens, the more savings is going to happen. But there is savings to a health plan throughout that entire journey. And so, having a solution like you guys for an employer, to me, is a no-brainer and will pay for itself. And then not only that, but the way I look at things is cost, service, and people. And so that's the cost side. What I was just talking about, the people side of it, that's what I'm experiencing personally. And you guys knock it out of the park on the people side of it. Mm-hmm. And so thank you. I'm happy to be able to spend this time with you guys.
I have nothing else to add because both of you did such a great job closing. Thank you, Matt and Dr. McDonald, for joining me on my live.